Mhm.
Okay, so we are super excited to have Dr. Johanna Gaskins with us, nurse practitioner, graduate of the Functional Medicine Fast Track program, coming in to discuss her journey with us. So welcome, Johanna.
Thank you for having me, Garric.
Super excited for you to just join us and just fill us in on your journey. And love to hear just from the word go, what was the biggest outcome you got after graduating from the Functional Medicine Fast Track program, if you had to put it into one sentence?
I'd say the biggest outcome I got was just having more confidence in the feeling that I was positioned to help save my own life over a long period of time. So that was the biggest for me.
Wow. Well, so maybe take us back to what was your situation before the program then?
Mm-hmm. Well, in 2014, I was studying a good bit. 2013, studying a good bit for my doctoral program, focusing on integrative health and healing, and I wound up with blood clots in my lungs. How they got there, nobody knew, but that was the start, and not understanding why. I hadn't thought about functional medicine. It wasn't in my purview at the time, but I was studying about natural healing and healing arts practices, just keeping in line with the nursing ideas of practicing least to most invasive care. When that care turned around and I needed it, I needed answers. And to make that long story short, I really did not get the answers that I wanted from traditional medicine. And I had the best pulmonologist and very well-educated doctors that were working with me.
Wow. Okay. So how were they kind of treating you on a conventional medicine side at that point?
Well, my pulmonologist told me that I would probably need to be on Coumadin for the rest of my life because my blood clots were considered unprovoked. No smoking, no birth control. I knew my symptoms. I took myself to the emergency room and I had the door seal full of specialists who didn't understand why I was still alive and breathing, considering I had substantial blood clots to both my lungs. So I had one of the best pulmonologists. My PCP was a physician who had been a physician for 50 or 60 years. After 6 weeks or 6 months of my Coumadin therapy, I wanted to do the genetic testing, which helped me understand that I had a genetic variant called MTHFR. And when I asked what that was, I was told that it was really nothing compared to the other von Willebrand and factor V Leiden, so that I could just get on my Coumadin, get my blood checked every week to make sure my INR was good, and that was going to be my treatment plan.
Wow. So even as you gathered more data and understanding the complexity of your problem, the treatment regime stayed the same.
It stayed the same. No one asked about anything else, how I might have gotten to this point. No one asked my very valuable question of why. No one could answer that question. Why did this happen to me? How did this happen to me? And when people die of pulmonary embolus, you kind of don't want to not know what's going on with you.
Got it. So what made you decide to actually dig deeper into your condition and finding out, how you could solve it in a different way to conventional medicine?
Well, it was actually a friend of mine who was studying some form of integrative therapy, and she wanted to use me as a sort of a guinea pig, somewhat like a case study. And she asked for 2 years of my labs. At that point, 2 years had gone by, and I still had no answers, and I was just living obliviously with my own variant. And she asked me and assessed my labs, and her eyes went wide open, and she schooled me because I had no thought to dig deeper into what MTHFR was. And she was shocked that I was just walking around doing nothing after knowing that information. So she really set me on a path to understanding what that really meant. And the more I dug into some of her work that she was trying to help me understand, and some of the suggestions and recommendations she had, I was fascinated by it. And just like I always know from my own life that once I start digging into something, I start finding other things, which led me to a very long post that I sat and read about a physical therapist who came across functional medicine fast track. And he was speaking my language. My heart started beating so fast. And I think in a 24-hour period, I was on the phone with you.
Crazy out. Yeah, our paths meet, destiny, for sure. So before starting with the pro and while you were in that journey, how was your life affected at that point? How were you feeling? How was your life, family life, work life?
Well, I was very active prior to this, prior to the blood clots and the sequelae from the blood clots. I was running on a regular basis. I was very in tune with the physical capabilities of my body. I was strong. I was energetic, and frankly, I looked good in everything I put on, which is what every woman wants to know, that when she puts on something, it's going to fall the way she wants it to fall. And that's speaking for me. I enjoyed that part. And I remember after 6 months, I had gained so much weight, and I was so afraid that everything I did, every time I was short of breath, every time I walked up the stairs, I was just afraid I had another blood clot in my lungs. What was I going to do? I was really afraid that my husband was going to wake up and, find me laying there with rigor mortis. I had just really hard feelings about what would happen if I died in my sleep from more blood clots. I had no direction. So it really was hard on me. My husband was afraid that there was something about my health that he didn't understand. He's not in healthcare. He's an engineer. So he was really afraid of what was going to happen to me. So it was really hard for my family to feel like something was going to take me away, and we just didn't know how or when or why. No answers from anywhere.
Crazy. And you think there's so many patients out there kind of feeling the same way. How did you feel having the medical background already and still being in that position? How did that make you feel, just with the training that you had gone through, and now you were kind of stuck in this position that this may be the rest of your life?
Well, it makes you feel really helpless, and it makes you feel hopeless. The good thing that did come out of that is I became a person that was fearless and unstoppable with anything and everything I wanted to do, because I figured if I'm going to die before I'm 50, I better do everything and not worry about anybody. I better live all my dreams, just in case my life was cut short. I start talking to my kids about loving mommy without a body. And, there are just a lot of things you kind of think about. But none of my training prepared me for any of this. Like I said, I didn't know what the genetic variant was. I didn't know how to help myself. There was nothing that I had read that was going to position me to help myself. None of the providers I went to were going to tell me how to help myself. So there's no training that I've had thus far that has positioned me to help myself, not as a registered nurse of 25 plus years, and not as a nurse practitioner.
Crazy, crazy stuff. So you had had some introduction to integrated therapy from your friend, you had said. Was functional medicine part of that conversation at all? Was that something completely new when you came across me and started speaking to me?
It was really, if I reflect on it, it was really completely new, some of the things that she was talking to me about. I mean, she talked to me about my B12 and my folate. Now, it was still difficult for me to integrate the ideas of all the sciences that I had learned prior to going into nursing school as prerequisites. And when she really started to bring my attention, I mean, I want to say I was thinking about so much of what it meant to be in healthcare from my brain to other people that I never applied any of what I could have been applying to myself and what was happening to my cells. And she essentially was studying, I think, integrative nutrition, and from that perspective, she brought some of the ways that my body would be depleted, or the ways I would have to really take care of my body. She brought those things to the forefront for me.
Got it. So how did you come across functional medicine fast track?
Mm-hmm. So similar to the way I came into, I got my doctoral degree from the University of Minnesota, Twin Cities, the Center for Spirituality and Healing. And the way I found that program was similar to the way I found functional medicine fast track. It was almost like I put out an energetic call, and all of a sudden I was looking at it on the screen. And I mean, I don't want to sound woo-woo, but some of my story is pretty woo-woo, because I knew there was something that I needed. The more I read about MTHFR and all the ways that the body can really be destroyed by unmanaged homocysteine levels and depleted B12 and folate levels, and the more I read about it, the more I thought to myself, well, good grief, everything I've gone to school for now, it's not even going to help me save my own life. And I just remembered, I mean, I hadn't been Googling functional medicine at all. You know how they have the algorithms and things like that, where whatever you think, you're going to get more of what you think. That's why I was so shocked to come across this post. And this post was super duper long. I can't even tell you. I mean, you can't even sit and read this kind of post and have a life. But the story was so riveting and so gripping. I certainly thought to myself, well, good grief, can I do this for myself? Before I thought about helping anybody else, I need to put my own mask on and help myself. And I couldn't tell you who this person was. What I can tell you is that the story about his health challenge and his journey through functional medicine fast track and what he learned, in the amount of time that he learned it, I thought to myself, well, I've been going to school for 15 or 18 years and I can't save myself right now. What is 12 weeks going to do? So I thought to myself, this is something I'm going to just have to jump in. And I had just finished my NP, and I remember just saying to myself, I have to research this, and I have to find out how this body of knowledge can support me in having my optimal life.
Love it. You really follow your heart and you move through that journey so fluidly. And yeah, it's amazing how the universe brings what you kind of think and attract. So can you remember the first thing we told you to do in functional medicine fast track?
There were so many things. I remember a few things that really resonated with me, and what you might have told me and what I heard might have been two separate things, but I can remember you always saying to settle down within yourself and just find that quiet place, to really start to shift the mindset, really start to shift the mind. And I can remember you guys talking about finding your niche and to really understand what it is about, you know, my personal gifts that were going to help enhance my particular goals in my practice. I was thinking about my own life. I could not think about my practice at the time. So I think I was kind of jumbled in, like, okay, my niche, my practice, what about my, I want to breathe. So eventually some of the things that you guys talked about, really, once I was settled in and I felt comfortable that I understood what happened to me, I immediately turned my gaze toward, my goodness, how can I help other people? So then I started reflecting on the conversations that your team had with me about, or just had with our community, our group, about how we can settle in and figure out how we can support other people in this.
Love it. And how did the process go with your own health through the Functional Medicine Fast Track program?
Well, it started with some labs and understanding what my levels were and understanding which supplements, what type of diet, which type of lifestyle I would need to lead from here toward infinity and beyond. So I really started to put in place certain behaviors that would help me manage my stress. That was one of the things that was happening to me when I was in my graduate program. I was so afraid of failure that I sat more than I should have. I probably drank more wine than I should have, which is a problem with this variant. The worst thing ever is that the wine was too much. But managing my homocysteine level and learning which supplements I probably have to be taking for the rest of my life, what kind of activity I would do, how important my sleep would be, actually listening to my body. Those are the things I really learned to do while in the program, mostly listening to my body, because it talks to me.
Yeah, absolutely. It's amazing how intuitive we have to be to get our own health right, along with the right labs and understanding the personalization that goes along with that in functional medicine, getting to the root cause as deep down as genetics go. Absolutely. So how did you feel about the whole process of change and a different way of thinking alongside your nurse practitioner degree and understanding there?
Well, my first shift in mindset was very personal. I had to realize that I was dealing with a different me. It was a me that I understood on a more personalized level. To understand my own needs being very different from another person's needs. So on a professional level, as a nurse practitioner, you know, we learn about health promotion and disease prevention in a very different way than this way, the functional medicine systemized way. We learn that health promotion might be immunizations. It might be maybe connecting someone with a social worker to help, or someone in behavioral health to support a patient who's having challenges. And our idea of disease prevention is mostly around screening. So I can screen you. I can write a script for you to have a mammogram to detect whether or not you have a lump in your breast. But I cannot I'm not positioned to do the detoxing or improve the diet or get rid of the inflammation that might actually promote the environment where a cancer can thrive. So I'm not positioned as a nurse practitioner to do that. So I wanted to move away from the idea of catching things to move toward the idea of preventing from a real place of knowing and on a very cellular level. And so far, I haven't had a patient or a client who's been the same as another client. So if I put my nurse practitioner hat on and the idea is that I could prescribe a medication for a symptom, well, that medication is going to do two different things to two different people. So I keep that in mind about why some of the disclaimers are on certain medications, that there's a risk involved because this medication may help your symptoms and this medication may kill you. So I understand on a very basic cellular level, and depending on a person's level of toxicity and things like that, toxic burden, that I may have two different outcomes if I'm managing two patients in the very same way.
So help us understand, we hear that your health has dramatically improved after the functional medicine fast track program, with understanding yourself and putting a personalized program together. How else has your life changed, and how are you working professionally?
Well, my life has changed in a lot of ways. I mean, I'm not as fearful about much having to do with this particular variant. I took all the genetic testing and things like that, and my genes are I have fairly good genes, I want to say. But this was really, this genetic variant was really rough on me. So I am as energetic as you find me right now. I get my 7 to 8 hours worth of sleep. I don't drink coffee. I don't drink any stimulants. I'm raring to go. Most times I'm this happy and upbeat because I feel well. I'm not in pain. Sometimes, you get to sitting too much. I try not to sit as much just because I have work to do and it requires sitting. I have my Fitbit on, so I get up and move around and walk around, and I can do higher impact exercises to try to manage my weight. I do have breathing problems still. I do have right-sided cardiomegaly just because of the resistance from the scarring from my lungs and things like that. So I manage those things as best as possible. And the more I'm able to increase my endurance and things like that. We bought bikes, we've gone bike riding. So I can say that my family and I are a lot less stressed about things happening with my health, the unknown of things happening with my health.
Amazing story. Yeah. And that is priceless, really, when you think about it. I mean, yeah, I mean, you can just talk about that forever. So Johanna, I want to ask you, many health professionals feel disheartened with conventional medicine, and really their spirit is broken. How would you say your spirit is now?
Well, it really still is broken when it comes to all the things that I've learned about conventional medicine. But I've learned to compartmentalize in that, modern medicine is there for, the acute issues of the day. If you need something now that saves your life, then you do what you need to do now. But we must have a longer term plan. And what is that longer term plan? It can't just be to go up and up and up on the next medication and the next medication. So I would really say that there is an opportunity for healthcare providers, nurse practitioners especially, to continue to rely on what we've always learned in different models of care about health promotion and illness prevention when it comes to this body of knowledge, this functional medicine process and practice. So there are opportunities for providers like nurse practitioners and others to really dig into some of the basic work of what we've already known, what we've studied since long before having the right to prescribe, about what happens with the cells. And we can really be positioned to support our patients in a major way if we just have a little bit more skill, a little bit more understanding and awareness of what this work can do on a personal level and on a professional level.
100%, 100%. And that leads me to my next question is, what take-home message can you give to the people listening in?
The take-home message is this. We are all sick in training. If you have not been diagnosed with something and you have never done work to sort of understand what's happening in your own body, the likelihood that you will be finding out new information about something that's going wrong is more likely than not. So having the opportunity to dig a little bit deeper, to come to the awareness that there are ways that we can prevent illness in the body by taking certain steps, certain actions, that we can certainly position ourselves to help ourselves, our families, our clients, our patients in a very, very major way, that things that they can take home and take with them as they walk into their future. We don't have to be in this despair. We don't have to feel useless in our knowledge and our education. We can add another tool to our toolkit to support our own health and well-being.
Yeah, love that, love that. And what would you say to those that are sitting on the fence and thinking about joining functional medicine fast track?
Well, like I said, in 24 hours, I was on the phone with you. So I really do agree 100% that you have to understand what it is that you are grappling with. You're grappling with staying the way you are right now and being confused and bewildered, and actually starting to join a community that is speaking to you in a way that feeds you. If you're looking for functional medicine, something is calling for you to learn more and do more. So if anyone is sitting on the fence, it's good to be decisive about what it is that you want to do. 12 weeks later, you will, if nothing else, you'll be more curious. And curiosity, if it killed the cat's got 9 more lives.
Love that, Johanna. So thank you so much. I think we're going to wrap up now. And for all of those that are listening in that want more information, please, there's 2 possible next steps. Either go to our website, functionalmedicinefasttrack.com. You can get more information there. If you want to listen to our webinar, click the Learn How button, and that'll take you straight to our webinar. The other option is, if you've already done your research on the website, you've watched the webinar, you know what your next steps are and goals, then book a call with our team. And that you can go to functionalmedicinefasttrack.com/apply. And that will give you the opportunity to book a time and fill out a short form and speak to our coaches. So Johanna, I just want to thank you again just for your insights. It's been just wonderful knowing you, watching you succeed. And I know there's many, many more great stories to come from you about patients getting better and you personally just changing your life for the best.
Mm-hmm. Well, I am looking forward to continue to interact with the community. It really feeds my soul to be a part of this community. So thank you for the opportunity to talk to others who might have been sitting in the same seat that I was a little while ago.
Thank you so much all. Take care and we'll see you soon.